Hi, I'm Ji-Yong Park, Jeju National University in Veterinary Medicine. Today, I'll talk about substance A has no immunology disorder, the acute atopic dermatitis in DNCB-induced model. Nowadays, atopic dermatitis is worldwide disease, very long time and very important disease. For child, atopic dermatitis is very critical cause its clinical symptoms. Itching, xerosis, eczema, redness, edema, etc. are examples of atopic dermatitis' clinical symptoms. Let's talk about atopic dermatitis. Atopic dermatitis has acute dermatitis and chronic atopic dermatitis. Acute atopic dermatitis is immunological disorder caused by Th1 cell and Th2 cell imbalance. Acute dermatitis is Th2 cell predominance and chronic dermatitis is Th1 cell predominance. I want to see the acute dermatitis that it is Th2 cell predominance. We use substance A to sample. What is substance A? Substance A is purified snake venom peptide. In my previous study, we showed that substance A alleviated atopic dermatitis. It can show at slide 13 to 18. But we don't know its safety. To know about its safety, we use FACS and Hematology. FACS, called as full-scanned activated cell sorter, shoot incident light to sample and get force scatter to get size of the cell data and size scatter to get granularity and complexity of the cell data. And we use fluorophore labeled antibody and shoot excitation light. We can show samples color, antibodies activation. I use these samples expression by two-dot plots to show double positive, double negative, etc. To do the experiment, we use DNCB-1-chloro-2,4-dinitrobenzene to induce acute atopic dermatitis and AOO called acetone olive oil to allow material to be applied well. This is my test plan. We use 5 weeks male biopsy and grouping like this table. This figure 1.8f shows skins the substance A loading progress after inducing atopic dermatitis by day. In group 1, there has no redness, no scab, figure 1.8f. But there has redness and scab, figure 8f, group 2. This result shows that substance A alleviated atopic dermatitis. And figure 2 shows FACS getting present lymphocytes. We can show CD4 positive, CD8 positive, and CD45R positive of all 4 groups has no significance. This means that substance A not trigger lymphocyte imbalance. Figure 3a shows the hematology analysis of eosinophil and basophil's number. We can know about its graph that substance A not trigger eosinophil and basophil's number imbalance, but mouse we used has not same weight. So I do the additional experiment, and figure 3b shows hematology analysis of eosinophil and basophil's ratio. We can know about this graph that substance A not trigger eosinophil and basophil's ratio imbalance. After this experiment, all the conclusion says that substance A has no immunology disorder to acute atopic dermatitis in DNCB-induced model.